Hi, my name is Christine Ng. Today I will be teaching about hypertension. I am a student nurse at Indiana State University. So what is hypertension? It's also known as high or elevated blood pressure. It can also be known as the silent killer because a lot of people who have it don't even know that they have it. It's an increase in cardiac output, an increase in vascular system resistance, or both. Multiple renal and neuroendocrine and cardiovascular control systems affect cardiac and vascular homeostasis, and that's what happens when you have an elevated blood pressure. Normal blood pressure is usually 120s to over 80s, so your systolic is the top number. So it's like 120s to 130 is your normal blood pressure, and diastolic is usually 80s to 90. Hypertension is usually above 140 and over 90. And like I said, it's also known as the silent killer. What are the risks? So heart disease. You can get a heart attack if it's really elevated. Like I said, if it's above like 140 over 90, there's some people who have a normal blood pressure, and this is when they're hypertensive. It's over 150 to 160. If it gets above to like 180 to 190s, even 200 on that top number, the systolic number, can get really dangerous, and that's when a heart attack or a stroke can happen. Heart failure, peripheral arterial disease, aortic aneurysms, kidney disease, and vascular dementia. What are the risk factors? So age, as you age, you can get hypertension. Race is also a risk factor. Family history, if you have family history of hypertension. Smokers, and lastly, being overweight. How is it usually diagnosed? So usually any doctor can really diagnose you with it. Your primary care provider can diagnose hypertension by checking your blood pressure. Usually they'll do they'll have you take your blood pressure on like a daily basis, keep a record of it, just to make sure that your blood pressure isn't actually elevated because you're in the doctor's office, because that can be known as white coat hypertension, I believe. So they like to keep a record and see if it's really elevated before actually giving you that diagnosis and starting treatment. So stage 1 hypertension is an early form of hypertension. Treatment will usually be lifestyle modifications, and I'll talk more about that later. And then stage 2 hypertension is when your blood pressure numbers are dangerously high, so like they're just constantly in the 140s, 150s for the systolic. And then that's when medications are usually started to prescribe. So like I said, there's not usually any symptoms for hypertension, so that's why it's called the silent killer. But usually when you're a little hypertensive, you can get a headache, nosebleed, fatigue or confusion, some vision problems. You can have a little bit of chest pain, shortness of breath. But like I said, these symptoms usually only appear when your blood pressure is extremely high. How to check your blood pressure. So you want to make sure you find a quiet place and obtain your stethoscope. This will be a manual instruction. So you roll up your sleeve and remove any tight sleeve clothing on the designated arm. So it can be in the left arm, the right arm. With dialysis patients, you don't want to put it where the fistula is. You want to put it on the opposite side. And then you want to secure the cuff. Make sure it's nice and tight. Not too tight, but just snug. With the arrow pointing to the direction of the artery. And then you want to place your stethoscope head over the artery and listen for a pulse. That'll be usually your brachial artery. Keep your feet flat on the floor. And then once you're all settled with the cuff and the stethoscope head over the artery, inflate and deflate the cuff to make sure it's working. Like I said, if it's manual, hold the pressure gauge in your left hand and the bulb in your right. It'll be hard to listen with trying to keep the stethoscope, so usually there's clips on the gauge, and you just kind of attach it to the blood pressure cuff, or you just lay it on your thigh or just somewhere you can see it. And then you want to close the airflow valve by turning the screw clockwise. That'll make it close and tight, so when you inflate it, it keeps the air in the cuff. And then inflate the cuff by squeezing the bulb with your right hand until it reads about 30 above your expected blood pressure. And then slowly release the pressure of the cuff by opening the airflow valve counterclockwise. And while you're doing this, you're listening with your stethoscope, right? And then as you're slowly releasing it, listen for that first pulse beat and note that reading. It's like, for example, if it's like 135, so that'll be the first beat, and that's your systolic blood pressure. Then you keep deflating, listen until you no longer hear the beat, and then note that reading. So that'll be the bottom number, which is the diastolic blood pressure. So say it's like 85 or 86. And then right after that, you just allow the cuff to completely deflate, and then you have your blood pressure. So the systolic blood pressure is the first beat, and then the diastolic is the last beat that you hear. Treatments for hypertension is usually weight loss, decrease your salt intake, decrease your alcohol intake, increase your physical activity, reduce any kind of stress that you're having, stop smoking, and then certain diets. If it gets to be to where it's not manageable with lifestyle modifications, that's when antihypertensive medications come in, and your doctor will be prescribing that. So for lifestyle modifications, you want to change your diet. Most common is the DASH diet, stands for Dietary Approaches to Stop Hypertension. It's rich in potassium, calcium, and magnesium. It limits foods that are high in sodium, saturated fat, and added sugars. So your daily intake would usually be grains, 6 to 8 servings per day, vegetables, 4 to 5 servings per day, fruits, 4 to 5 servings per day, fat-free or low-fat dairy products, 2 to 3 servings a day, lean meats, poultry, and fish, 6 1-ounce servings or fewer per day, nuts, seeds, and legumes, 4 to 5 servings per week, fats and oils, 2 to 3 servings a day, sweets and added sugars, 5 servings or fewer a week. So you want to limit your fatty meats, a full-fat dairy, sugar or sweetened beverages like Coke, pop, any kind of sweets, ice cream, chocolate, candy, and then especially sodium intake, because that will definitely increase your blood pressure. And that is all I have. And there are my references. Thank you.